I would like to start today's session. And first of all, I'd like to introduce our panelists today. So Dr. Elizabeth Dolan is the Interim Dean of College of Health, Professor of English and Professor of Health, Medicine and Society. Before joining Lehigh, she was the Senior Fellow in Literature and Medicine in the University of North Carolina, Chapel Hill School of Medicine. Dr. Christine Daly is the Chair of the Department of Community and Population Health and Professor of Medical Anthropology in the College of Health. Dr. Daly came to Lehigh from Department of Family Medicine and Community Health at the University of Kansas School of Medicine. Dr. Anand Jagota is the Associate Dean for Research in College of Health and Professor and Founding Chair of Bioengineering, as well as Professor of Chemical and Biomolecular Engineering in the College of Engineering. Before joining the Lehigh faculty, Dr. Jagota was a research scientist for the DuPont Company. Dr. Michael Gusmano is Associate Dean for Academic Programs and Professor of Health Policy in the College of Health, as well as a research scholar at the Hastings Center. He came to Lehigh from the Rutgers University School of Public Health. We are also lucky to have two current College of Health students available for questions after the presentation. Mariam Khan earned her bioengineering degree at Lehigh in 2020. She currently works for AstraZeneca as data scientist. Abby Breyer is studying population health in the College of Health and is considering a career in epidemiology or epidemiological research after she graduates in 2023. In the class of 2024, Isha Soni is earning her BS in population health with minors in mass communication and entrepreneurship. In the future, she plans to be a media correspondent. And Maddie Short is earning her BS in population health. After graduating in 2024, she is interested in pursuing her career in epidemiological or healthcare law. Now I would like to invite Dean Dolan to take this workshop forward. Thank you.
Thank you so much. I appreciate that. And good morning from Bethlehem, Pennsylvania. I hope you all have had a great day and are either eating dinner while you join us or perhaps preparing for dinner. To give you a sense of where we are in the world, Lehigh University is just over 60 minutes from Philadelphia and just about, on a good day, a little over 90 minutes from New York City. So we're in a great location. We're honored that you're taking time today to engage with our webinar, and we invite you to reach out really at any time after this webinar via email or obviously through Shashir at any point. I'm going to offer a high-level overview of growth in the healthcare employment sector to get us started off. And then Dr. Daly will discuss career opportunities in clinical health. After that, Dr. Jagota will turn to opportunities in health technology for careers. And Dr. Gusmano will share information about career opportunities in public health, health policy, and global health. So we're going to cover a lot of ground pretty quickly, but we are still intending to leave 15 to 20 minutes to address your questions at the end. We invite you to enter questions into the Q&A at any point during the discussion. We won't stop to answer them until the very end, but as they occur to you, feel free to throw them in there and we'll get to them. And your questions will also can be directed at our 3 students and 1 alumna who've joined us today. I think that's a great opportunity to talk to students who are in the middle of this kind of, on the path to a career in health or actually starting a career in health. So just starting with the first slide then, as you guys probably know, the healthcare sector is booming in the United States, creating new jobs every day. Currently, there are job opportunities in nearly 1 million different companies, nonprofit organizations, and of course, government entities within the United States. And between 2019 and 2029, job growth is predicted to grow 15%, adding 2.4 million new jobs or 250,000 jobs per year. Next slide, please. In India, the picture is much the same, as you guys know better than I do. There's rapid revenue growth in the sector and rapid growth in the labor market as well. The publication Business Standard predicts that between 2017 and 2022, 2.7 million new employment opportunities, or more than 500,000 jobs per year, will be added. That's new jobs. Next slide, please. So just quickly want to sort of think a little bit about what the nature of this growth is. So yes, there's growth. What are these jobs going to look like, especially in the future? You know, not so much today, but maybe the day that you graduate from college. What is this job market going to look like? So to explore this, I'm dipping into a report from Deloitte consulting firm. They have a huge health care practice and expertise in this field. So they're trying to predict what will happen as a result of COVID-19, as a result of the pandemic that we're still in. And they anticipate that COVID-19 will jumpstart digital transformation in healthcare, most obviously in, in AI, cloud computing, digital monitoring, and virtual care delivery, as well as in innovation in care models, awareness of the effectiveness of the effect of social inequities on health outcomes, and the value placed on collaboration across sectors. Next slide. So each of these trends implies an increase in related job opportunities. I'm not going to take a lot of time here, but you can see in the right-hand column that there are related jobs to these trends. So here we're looking at digital transformation. And so further innovation in this area will expand, hopefully, access to health services and create a more effective care experience, according to Deloitte. So Deloitte explains healthcare organizations are transitioning to health IT systems powered by cloud and data and analytics tools to enable real-time smart digital health. They're using interoperable data and platforms supported by deep learning capabilities, always-on biosensors, and behavioral research to shape consumer beliefs and actions. They're also applying virtual care, AI, and other technologies to personalize medicine, enable real-time care interventions, and provide behavioral nudges. So one of the challenges in this sector, this area that Deloitte identifies, is the creation of interoperable data. So since the implementation of electronic medical records and the growth of big data, really mega data entities such as Google, Microsoft, and Amazon, we've accrued mountains of data, globally speaking. And as Deloitte notes, to use this data effectively, or these data effectively, we need to refine the interoperability, or how the data can be analyzed together when you bring those data sets together, so that healthcare providers, insurers, and other stakeholders can use it effectively. Next slide. So COVID-19 highlighted longstanding, or is still highlighting longstanding challenges in healthcare affordability, access, quality, and efficiency. And these are problems that can be addressed with care model innovation. So this innovation is related to the digital transformation. So Deloitte observes that more than ever, consumers will expect care to be available when and how it's most convenient and safe for them. And this includes virtual care, at-home prescription delivery, remote monitoring, digital diagnostics and decision support, and self-service applications for education, behavioral modification, and social support. I think one of the big takeaways here is that during the pandemic, people didn't want to leave their homes. And they still, of course, wanted access to healthcare. And so that implies a lot of change in processes and, of course, in digital. So next slide, please. So as we all know, globally, COVID-19 also really threw into sharp relief the ways in which systemic social disparities, including across the globe, not just within the United States, but globally, led to health inequities. So to address this issue, we need to focus on the 6 upstream factors listed on this slide. Deloitte predicts an increase in the need for professionals in the careers listed to the right, and these professionals will need to understand the social determinants of health to actually make a difference. Last slide. So fourth, and finally, in this overview, as we all know, a vaccine for COVID-19 was developed in record time, in part due to unprecedented cross-sector collaboration between academia, industry, and government. So this kind of partnering is something that we should study, that policy experts should study and figure out how to implement for other global health challenges. And that study and growing in this area of collaboration has implications for job opportunities as well. So thank you for that, listening to that quick overview. And I want to now turn it over to my colleague, Dr. Daly, who will talk about clinical opportunities.
Hey, hello and welcome. Glad you could join us this evening for you, morning for us. So I'm going to talk to you a little bit about clinical work. And as Shashir mentioned earlier, what most people think about immediately is things like being a doctor, maybe being a nurse. And so I am going to touch on those, but then I want to sort of explore some of the other wonderful opportunities that are out there in the healthcare field. So yes, you can absolutely be a physician, and within physicians, we have people who do primary care, people who do more specialty care, say, cardiologists or pulmonologists. That's heart and lung if you're not familiar. You can also have people who do surgery. I'd like to mention also physician assistants as an opportunity. These are folks who do a lot of similar things to physicians, but take a little bit less time in their training and are often really focused in on that primary care sector. And there is a huge need for physician assistants, particularly in rural areas all over the world. You can also go into the field of nursing, and of course you can do what we think of as standard nursing. You can also do higher level degrees in nursing. So a nurse practitioner, again, does much of that same primary care that a physician or a physician's assistant would do and are in huge demand. You can become a nurse midwife or a nurse anesthetist. Nurses are actually taking over quite a bit of anesthesiology, and so huge need there. Or psychiatric nursing is also a prominent field. Of course, you can go into dental medicine or dental surgery. You can also go into pharmacy and be either a pharmacist or a pharm tech. So those are kind of what I would consider to be the fields that most people think about when they think about clinical healthcare. But there's actually a vast number of other fields. Next slide, please. So let's think for a moment about if you want to go to medical school. So I know in India, the MBBS is a degree that most people are thinking about. So many of you are probably considering that, or I hope many of you are considering it. There's a huge need. If you are thinking about coming to the United States for college, we don't offer the MBBS here. Here we have you do a 4-year degree in college in some other field. And what you see on the screen in front of you is the different fields that are represented in the people going to medical school in the US in 2020. So we have you go through a 4-year degree, then you take something called the MCAT, which is an admissions test, and then you can go on into medical school. So you'll see that most people who decide to go that route are going to major in something like the biological sciences or maybe the physical sciences. I will tell you, though, that in medical schools in the United States, we are increasingly seeing and wanting people who have a diverse background in terms of what they studied as an undergraduate. So the social sciences, the humanities, and the specialized health sciences, which is something that we do in our College of Health at Lehigh, we really focus in on getting people a broader experience. And that's what a lot of medical schools are looking for. So I would encourage you, if you're not sure if you want to go into medicine or think you might want to go into medicine in the United States, consider that 4-year undergraduate degree first. It gives you a really nice, solid foundation. And if you're honestly not sure what you want to do, you are not alone. Many people don't know what they want to do when they're just finishing up, getting ready to determine college. Consider one of those other fields of study. Next slide, please. Okay, so I mentioned that there's all of these other careers that you can go into aside from physician, nurse, dentist, pharmacist. These are some of them. So you have probably heard of folks like Doctor of Chiropractics or chiropractors, or maybe an Ayurvedic medicine practitioner, which I don't think I put on there. But there are other types of doctors as well. But then there's this other realm. So you could be a social worker or a psychologist focusing on mental health or issues like that. You can go into physical therapy, occupational therapy. Those are hugely needed. Definitely not enough people in those fields in most parts of the world. You can go into speech language pathology. So, help kids who have trouble with speaking, or adults who have had a stroke and are having trouble with speaking again. You can go into dietetics and help people with nutrition. Or you can go into something like laboratory medicine tech. So there's lots of different career opportunities out there in clinical medicine that are not just physician. So if you think you might have an interest in one of those areas, look into it. And certainly reach out to us. We can help you, kind of go through some of those. But I really encourage you to think more broadly than just getting the medical doctorate. Okay, next slide, please. Okay, the other piece of clinical medicine is the research end. Many clinical physicians, nurses, et cetera, are on the research end, but there are also scientists on the research end who do clinical trials. And so that's where you have something like drug discovery. So first you have the preclinical phases, which is when you discover the drugs. You figure out, what those drugs are, how they're going to be impactful. The one we talk about now, of course, is all the different COVID-19 vaccines. And those all started preclinical. They started before getting into humans. So you figure out the drug, then often we do animal modeling. And there's a lot of people in that field. Then you go into the clinical phases, the clinical trials, where you test it in patients. And so you test it in a small number of patients, see if it works, maybe modify the dose. Then you test it in a larger number of patients, and so on and so on. Ultimately, you get approval. And then you go into what we call the phase 4 trials. That's when you start really having everything out there in the population. You find out long-term effects 20 years later. So we have people working throughout all of those phases. This is one of the biggest growing industries out there in the world today, and we need good people doing that. And this is science, it's technology. It can also be behavioral medicine. So if you want to help someone lose weight or quit smoking or something like that, and that's all in this sort of drug discovery and clinical trials realm. And it is a huge opportunity, and we need good people doing this. So please consider it. Next slide, please. So who's doing this? Okay, obviously the medical schools are doing it. So the American Association of Medical Colleges, and there are corresponding associations of medical colleges all over the world. It can also be government agencies like the National Institutes of Health in the United States, or the European Clinical Research Infrastructure Network in Europe. So there are those government organizations. There's also private organizations like the American Cancer Society or the Bill and Melinda Gates Foundation. But there's also this huge group of companies, international-based companies with offices sort of everywhere, doing a ton of this work. And you can see there's a graphic there that shows you quite a few of them, but places like Merck, Johnson & Johnson, Pfizer, GSK, all of these different places doing a tremendous amount of drug discovery work in clinical trials. And so that's another big industry where jobs are just growing exponentially. So with that, I'm going to turn it over to Dr. Anand Jagota, who is going to tell you a little bit about that tech field.
Thank you very much, Dr. Daly. Excuse me, and welcome everybody. So I'm going to describe, try to answer the question, what are the degrees that train in health technology? And by that, I mean essentially what are the opportunities when you get a training in either engineering or the physical sciences. And you see a list of engineering fields here. The top one and the obvious one to talk about is bioengineering or biomedical engineering. That's synonymous in the field. But this field is relatively recent in the family of engineering fields and grew out of the more traditional engineering fields like chemical and biomolecular engineering, electrical engineering, material science, and so on. The last one is the newest of this field, and I'll say a little bit about that. Our alumni guest today, Mariam has actually figured out how to do this even without the presence of a program. And then there are sciences. So there's always a little bit of a problem of how to answer the question, what are the degrees that train in health technology? And what do they train you for? What kind of a career? Because the answer is multifarious. There are many, many ways of doing it. So to answer that question and to unpack it, I'd like to do the following. I'm going to walk you through this figure, which on the x-axis here has length scales in biology. So the smallest one here is an angstrom. That's the length of atoms. You go to 10 nanometers. That's the length scale of proteins interacting with each other. And you march up the length scale. You get organelles inside the cell. And eventually you get to our thumb, which is at the organ level, or the whole human level, and even at the population level. So that helps to separate out which scale you're looking at. And on the y-axis here, I put the traditional engineering disciplines which feed into bioengineering, biomedical engineering, which actually covers all of this. but it helps to go back to the original background of these fields to understand what the opportunities are. So in mechanical engineering, traditionally bioengineers in mechanical engineering would be working on prosthetics. This is a mechanical engineering design problem applied to a health field. But in modern engineering science and in research, this idea goes all the way down to the single molecule level and trying to understand interactions between individual molecules by doing what would be traditionally done on a big piece of material down at the single molecule level. If you look at chemical engineering, the obvious sort of application where you would get jobs would be in large chemical plants, for example, for vaccine production. That's basically a chemical engineering problem with all the constraints that come from having to make a really highly pure and efficacious production line. But again, there's in the modern chemical engineering, there's a lot of work at the biomolecular scale, which feeds into what a bioengineer can do. Let's look at electrical and computer engineering. The first thing that comes to mind at the larger length scales are things like the MRI, CT scans, but there's a lot of very interesting work going on point of care diagnostics, building devices where you can sense biomarkers in body fluids, for example, at not on a huge diagnosis company, but at the doctor's office at the point of care. Computer science, bioinformatics, this is one of the newest and fastest growing areas. The overlap between data, computation, and biology and health. This is exploding in opportunity. And I put it here on the small length scale because this deals more or less with data at the molecular scale. But there's a version of that jumping down with industrial systems and engineering, where there is data and modeling and optimization that one got trained for in industrial systems engineering, which can be applied, for example, to operating healthcare systems, large hospitals. So I hope this gives you a little bit of a feeling for the kinds of opportunities that training in bioengineering, biomedical engineering, or one of the other engineering disciplines in a health-related topic gives you. Just to give a little bit of an idea as to where bioengineers go when they finish. This is from the Lehigh class of 2019. This is Mariam's class. And you see that about half, usually a majority, go straight into industry. About a third go ahead and go towards more education, could be professional or could be in the field. And there's always a certain amount which we don't know about. So this is typical, at least at Lehigh. At other places, you'd see a big slice here also for students using the undergraduate engineering degree to go towards medicine or other professional schools. And this list here gives you an idea as the sort of companies to which our students go and then the graduate schools that they've attended. And the last thing I'll show you will be a suggestion to actually look up the website of the US Bureau of Labor Statistics. Dr. Guzmano will say a little bit more about another website. This one highlights data and information about bioengineers and biomedical engineers. And if you glance through, you can see the kinds of things. You can learn here what's the median pay for somebody in this field, what's an entry-level education, number of jobs, and most importantly, the growth of this sector. So with that, I will end and hand over to Dr. Guzmano.
Thank you, Dr. Jacoda, and welcome everyone. Thanks for joining us. I'm going to give a very brief and high-level overview of careers and specific jobs that are available in the related but distinct fields of public health, health policy, and global health. As Dr. Jacoda just explained, people in manufacturing and bioengineering come from a whole variety of different disciplines within engineering and other physical sciences. As Dr. Daly suggested, even in medical school, while the majority of students are studying biology and physics and chemistry as undergraduates, we have a growing number of people who come from different fields And the reality is within public health, health policy, global health, the areas I'm talking about, students are open to studying virtually anything you can imagine as undergraduates. Anything that's going to help you develop critical thinking skills, writing skills, math skills, can feed into a variety of different careers. So you can see, I've been teaching in public health, for example, for many years, and I have taught and worked with students who are coming in business, in the humanities, philosophy, the social sciences. Just on this webinar, you're seeing people with backgrounds in the physical sciences, in English, political science, anthropology, and so we ourselves represent the sort of broad set of fields. Next slide, please. So what kinds of sectors do people go into? And again, this is quite broad in public health. You may immediately think of government careers, people who work for ministries of health, departments of public health, and that is certainly the case. But people with public health, health policy, and global health training work for industry. If you think, for example, about companies that are developing some of the pharmaceutical and medical device products that both Dr. Daly and Dr. Jacoda were mentioning, they frequently will have people in public health doing needs assessments in the population to think about what the need for their product and how that's evolving. They are also heavily regulated industries, so they will often try to hire people in health policy to help them understand what's going on. And then there are some other sectors that you may not have thought of at all as places where you might work with degrees of this kind. People in foundations often hire analysts to understand policy, to think about the global health system and how they can contribute. Dean Dolan provided you with some really interesting information about the growth of the health sector from Deloitte Consulting. So various think tanks and consulting firms are often places that hire students with backgrounds in public health and health policy. Next slide, please. So what are some specific jobs? What can you do? What am I talking about? Again, some of these you may be familiar with. We know we've read a lot during the pandemic about the role of epidemiologists. I'm sure many of you have seen in newspapers and other sources modeling, talking about how the disease will progress. Those are often done by epidemiologists who look at large data sets and look for patterns and make predictions. And of course, they're typically working with biostatisticians. And so you have people who are working in more traditional public health fields, but again, also working in industry and government and think tanks, doing research, looking at everything from drug safety and evaluation to working in health systems to try to better understand how they can improve the quality of care. In the government and outside, we spend a lot of time thinking about policies, not just developing new policies, but evaluating existing policy. And so people with backgrounds in economics and statistics and political science and public administration will look to evaluate existing policies. And going beyond healthcare, thinking really broadly about health, a lot of people are interested in the environment, and not just the environment for the sake of the environment, but specifically looking at the implications of environmental change on human health. Next slide, please. So as Dr. Jacoda mentioned, these varied professions, some of which you may be very familiar with, like epidemiology, some of which you may not know much about at all, thinking about health policy analysis, people working in think tanks. Again, you can go into the Bureau of Labor Statistics and they have a specific searchable database called ONET. And like the database that Dr. Jacoda was mentioning, you can do searches of whole sectors or specific jobs, and it provides a wealth of information. What kinds of undergraduate degrees do people typically have? Do you need to go on to graduate school? Some of these jobs require graduate degrees. For others, entry-level jobs are available with a Bachelor of Arts or Bachelor of Science degree. And is this a growing field, right? We all want to go into fields where there is growth potential, and they will provide some projections about that as well. So it's a really helpful tool when you have specific questions about specific jobs. Next slide. So where do people who study public health, health policy, global health, either at the undergraduate or the graduate level go? This is, again, just a quick snapshot. These are some numbers from my previous university, but they're very typical of people who have studied population health and public health. So a number of our students have gone into industry. They went into pharmacy, they went into medical device manufacturing. Some of them ended up in the hospital sector, and you can see there's an average starting salary in 2019 of about $85,000. These are for people with a master's degree. Think tanks, I've already mentioned. Government is somewhat obvious, especially for public health and health policy. One that may be less obvious is insurance. Not only private insurance, as we have in the United States, but government insurance. So CMS stands for the Centers for Medicare and Medicaid Services in the US. Those are our big public programs. And I know people with backgrounds in public health, in health policy and global health who are working for the large health insurance funds in Japan, in France, and in Germany. And they frequently hire analysts with these kinds of backgrounds, degrees in economics, political science, sociology, anthropology. So there are a lot of really exciting opportunities in this growing field of public health, which, for better and for worse, we've all learned a lot more about during the past year and a half. So I'll stop there and turn it back to Dean Dolan, but thank you for listening.
Thank you so much to my colleagues. That was really interesting, and we already have questions coming in. But before we move to those questions, I'd actually like to invite the students and alumna who we have here today to introduce themselves. And if you guys wouldn't mind talking a little bit about your, your path in health. What are you thinking about doing? What have you done? Just anything you think you'd like to share with students who are thinking about college right now. So how did you end up in the place that you are in this moment? And let's start with our alumna, if that's okay. Yeah.
Well, hi everyone. My name's Mariam. So just as a quick background, I graduated Lehigh with a degree in biomedical engineering back in 2019. And then I stayed on for an additional year to also complete my master's at Lehigh. Again, biomedical engineering, but focusing more on data science. So just a little bit of a background. Growing up, I saw a lot of disparity between healthcare, and I knew I wanted to contribute in some way, shape, or form, but I was very adamant that I did not want to go the doctor route. I was always, more of the math person. I was interested in seeing how you could model the human body. And that's sort of where I found the biomedical engineering degree. And like Professor Jacoda said, the biocomputational engineering degree was not there. I always joke that I was born 5 years too late, too early for that. But I was really, really intrigued by the interdisciplinary nature of biomedical engineering, stuck with the pharmaceutical track. And then I realized, throughout the course of my internships and throughout the different courses I was taking at Lehigh, was that we have so much data around us in the healthcare field, whether that's related to patient level data, whether that's related to, the drug discovery process as well, that was talked about a lot. And I was really, frustrated by that. I was right, we spend so much time and money in investigating and developing a drug. It takes 10 to 12 years. 1 out of 10 drugs only make it to market. What are we doing with the rest of the data? And can we use it somehow to really speed the drug discovery process? So right now, I'm currently working at AstraZeneca as part of a data scientist. So actually in digital health, which was touched on a little bit earlier. And we're really focusing on developing patient-centric and decentralized trials. And what that really means is with COVID-19 vaccine, there's been a huge push for decentralization of clinical trials. People are now being responsive to the fact that we have virtual care available. We don't need to necessarily have a patient close to medical center at all. But we also want to help put the patient first. So right now we're doing a lot of population level data set analysis, looking at what is it that our patients need, what is it that they're reporting us when we conduct clinical trials, and what we can do with it. And then just one more thing that I'd like to shout out is the fact that Lehigh in general is a wonderful university as well. And if you're really interested in public health and figuring out what is it that you want to do, Lehigh actually has a wonderful United Nations representative program. So what essentially you can do is, as a Lehigh student, you can be a youth representative for a UN NGO. And the reason that I speak to this is because I spent around 3 years when I was at Lehigh being a representative for an healthcare-based NGO called CLAN, Caring and Living as Neighbors. And they worked a lot with children living with non-communicable diseases. So it was a phenomenal experience, being an 18, 19-year-old to go to the UN, which is headquartered in New York City, and speak on behalf of these NGOs. But also that for me was sort of what kickstarted being like, oh, like what else can I do in the healthcare field, right? Could I potentially work as a policy? Could I work as an advocate for healthcare and NGOs? What are the different routes that I can take? So again, that's just something to keep in mind as well. Outside of the wonderful support system that you have in College of Health, Lehigh in general as a university is well equipped to make sure that you can land wherever you choose to. So that's my little spiel.
Hi guys, I'm Abby. I'm a junior at Lehigh, and coming into school, I really did not know what I wanted to do. I actually thought about majoring in cognitive science at first, and I am going to pursue a minor in that as well. But as the COVID-19 pandemic started to emerge, I just was following the news a lot more and kind of learning more about what population health was. I had actually never heard of it. So as I started to kind of look more into that, I figured out that like encompassed all of my interests. And growing up, like I always was interested in medicine and health, but I never really wanted to be a doctor. And so I didn't know how to go about that until I learned more about population health. And it just kind of worked out the timing that as I was starting to find this like new interest, Lehigh was opening up this new College of Health, which has been so awesome. I've learned so much more about health disparities, biostatistics, and kind of how that applies to medicine. I've learned so much more than I ever thought like I would have about health, and I'm really excited to see where to go from here.
Hi, my name is Isha, and I'm a sophomore in the College of Health, majoring in population health, and then I plan on double minoring in mass communications and entrepreneurship. So I also am very interested in the health field. However, I don't want to be a doctor. Like I just don't want to do the 4 years of med school and residency and all that. And then I also have an interest for journalism, broadcast media. All throughout high school, I was part of my school's TV show, and I kind of wanted to incorporate that with public health. And, seeing throughout the last year with COVID, how different news outlets are distributing information about COVID-19, I thought it was super interesting. So I kind of wanted to mesh the two together and see what goes from there. So far, the College of Health has really helped me with that. I did research last semester with Professor Gomez on the media and population health. And then this semester, I'm taking a class called Media and Population Health with Joan London, who has experience in both health and the media.
Great. Hi there. I'm Madeline Shaw. I'm a sophomore at Lehigh as well, and I am getting my bachelor's of science in population health. I kind of came to Lehigh originally enrolled in the arts and science, College of Arts and Science, and then over the summer before my freshman year, I had been looking at the College of Health, and I really realized that that was something that I wanted to focus on. So I looked at a bunch of classes, kind of watched some videos, and I was able to write to our dean, and they gave me an override to transfer into the college before I started my first semester at Lehigh. So I've always been part of the College of Health, which I'm really grateful for. I've had a really great opportunity here with lots of opportunities. Over the summer, I was working with the Institute of Indigenous Studies through the Mountaintop program here at Lehigh for a project called American Indian Health. And education programs. So that was a really great internship. And I'm also going to be continuing to be an intern with the Institute for Indigenous Studies this semester as well. I've taken a lot of classes that have also introduced the different subjects of disease and how it spreads, as well as the different health disparities, which I find really interesting. I similarly have always been really interested in health and medicine, but knew I did not want to be a doctor just because I am one of those people that faints when they see anything medically related. So I just knew that wasn't going to work for me. However, I'm also interested in history and international relations. And I've noticed that the College of Health has really allowed me to bridge those two interests as well, because although we do focus on health, we focus a lot on different cultures and how that impacts different viewpoints of health, as well as the history of health. And there are a lot of classes that can focus on that. So that's my bio.
Wonderful. Thank you so much. We have questions for students and for others. And so I think I'll just start at the top here. And this is a question that came in first. How would one implement his education in entrepreneurship and any healthcare related major right after getting out of college? So I can give you a couple of thoughts on this, and then we'll actually kick it over to Isha, who's working on a minor in entrepreneurship here. So one thing that happens at a lot of universities, and certainly at Lehigh, is various departments will come together and offer students a chance to do a pitch contest. So this is a contest where students maybe from business, health, and engineering would get together and actually pitch an idea for something that might go to market. So we have had those kinds of competitions here at Lehigh, and other universities do them as well. Another thing to consider is while you're actually in university or in college still, consider an internship with a startup. And so again, that's something you can try to find on your own. That's something you can go to a career center at whatever college or university you go to try to get help with. Or at Lehigh, we do have a very special program here called Startup Academy. And right now it's for business students who want to work in startups in California, because we have a California office out there. We're going to also create an opportunity for health students, because a lot of those startups in California are health focused, health sector focused. So that's an exciting concrete opportunity that we have here, and other places might have things like that. But let me turn over to Isha, who's actually completing the population health major and a minor in entrepreneurship.
Thank you, Dean Dillon. So I guess with the entrepreneurship minor, I kind of took it first as something I'm super interested in. So that's one of the main reasons I'm minoring in it. But then also last semester, my first semester freshman year in the fall, I had to take a health innovation and technology course, which is 5 weeks. And each week we had to kind of build an idea, whether it's an app, a product that helped a certain health disparity. So mine was price transparency in the health field, and me and my group of friends, we came up with an app where people can find access to doctors around them and kind of chat with them before having to make an appointment and meeting them. So the setup and build up to that was very interesting to me. So this year I'm taking Intro to Entrepreneurship in the College of Business, I think, and it's been super interesting so far. So I guess I think with an entrepreneurship minor, you can kind of it's for any major you're interested in. You can always do whatever you want with it. And so I think it's very creative, and I really like taking classes that are more creative, that you can kind of do your own thing for, which again, the College of Health is really good for that. You really can kind of go into any field you really want to, along with a pop health major, because I know me and all my classmates in the College of Health, we all love population health, but then we also are going into our own thing. So I think the entrepreneurship minor, kind of a fun thing, but also there's so many different disparities and problems happening in the health field, and you can really kind of think of something that you believe can help it. So yeah.
Thank you so much, Isha. So we'll go to the next question, which I'll direct to Dr. Daly. In pharmacy, can we also look at careers in management and manufacturing of pharmaceuticals?
Quick answer is yes, absolutely. The degree you're going to want to pursue, if you want to go into pharmacy doing that kind of work, is the PharmD, which is a doctorate of pharmacy. So you'd get an undergraduate degree either in pharmaceutical sciences or in biology or chemistry or something similar. And then you go on to graduate school. And many PharmDs are working very much in drug discovery, primarily in industry. So that opens up a lot of careers in industry for you. So yes, you absolutely can do that.
Great, thank you so much. So here's another one for you, Dr. Daly. Is it possible to get a hefty amount of aid in the US medical schools as an international student after attending 4 years of bachelor degree at any US college, as well as maintaining other requirements? Yeah, good one for you, Dr. Daly.
Yes, it is absolutely possible. Obviously, many of these are merit-based, so I can't say for any individual, but there are a lot of different financial aid options out there. And when you're an international student, you can actually apply to different pots of aid here in the United States, but also in your home country. So many times there's aid available to you through multiple countries, and there's also private organizations that have specific aid packages. And so most of these places will look at people going into particular parts of medicine. There's particularly a lot of financial aid available for people who want to practice in rural communities, both in the United States and abroad. So there's lots of opportunities for that, and you can absolutely get that aid. And it really, getting your requirements done and things is part of what you need to do to access that aid. So it's not prohibitive at all. Those are the kinds of things that they look at. So they're going to look at, say, the types of grades you get in your pre-med requirements and things like that. So yeah, you can absolutely get aid.
And I would add to that there are also some special visa arrangements that individual states offer to promote international graduates of medical school, whether in the US or elsewhere, to work actually in rural areas, because that's an area of real need in the United States.
Absolutely, and in particular other subspecialties as well. People are always looking, a lot of these aid agencies are looking specifically for, a particular type of field. And so the more specific you can be, particularly when you're an international student, some of those visa requirements are easier to meet if you're going into more specialized medicine.
And I also want to add, one point here is that, it's all about your profile also. Sometimes students spend 2 additional years in doing their masters and working in the rural areas, building their profile, having some sort of volunteer hours also building into their profile. So, ultimately at the end of the day, it's a medical school and you have to get an admission. So they have to see that if a student is getting a scholarship, what's the rationale behind it? So there are certain areas like, emergency medicine is one of them, community medicine, Dr. Daly already spoke about. So these are some interest area. If you showcase that this is your passion area and you want to work in those areas, you get some good scholarships.
Great. All right, thank you so much. So this is a question for Dr. Guzmano. Can a student pursuing medical science switch over to public health?
Oh, absolutely. And at the undergraduate level, for example, many students at Lehigh and other places that offer degrees in population health or public health at the undergraduate level started out thinking that they wanted to be pre-med. The more they learned about what it was like to be a doctor or a nurse or a clinician, the more they decided that, maybe this isn't for me, and I'm really more excited about the population health approach. Similarly, I taught for years in programs that offered master's degrees in public health, which we're actually starting here at Lehigh next year. And I would say a large portion of the applicants to those programs started out pre-med, and maybe they eventually even want to go on to medical school or nursing school as well, but they really appreciate having that population health perspective, and they've decided to add the MPH onto their degree. So there are a lot of ways, either because you've decided to sort of switch careers and go in a different path, or simply because you want to enhance your understanding of how whole populations work and have that perspective as a clinician. I think both of those are valuable, but definitely possible.
Great. Thank you so much. So here's a question for our students. The question is, what sort of extracurriculars did you do in high school that maybe led you to take up a health-related major in college? So anybody can jump in, and you don't all have to answer if you don't have an answer to this one.
I would say I didn't really do that many extracurriculars in high school that would mirror the health degree that I am pursuing right now. I was kind of a big music kid, so I was in band and choir. I ran cross country. I played golf. So that's just a general thing for college. Definitely focus on extracurriculars and outside of academics just to look as a well-rounded student. But I guess some experience that I had in high school that impacted my College of Health major is when I was going into my senior year, the summer over that time, I went to Ecuador and I worked on a nonprofit organization that helped with health, like it provided health services to a rural area outside of Quito, Ecuador. And in those areas, the health resources are very limited and people often don't have easy access to see doctors. So I worked with a lot of kids that were very undeveloped. Their nutrition was very undeveloped. I saw people who hadn't seen an eye doctor in 5+ years who had cataracts. So I think seeing that health equity, inequity was really eye-opening for me and was one of the driving points for me to want to join the College of Health. So I definitely say that that experience in health medicine and going to a place that was slightly underdeveloped and didn't have as many resources was very eye-opening for me. So I'd say, even though that's not technically an extracurricular, that experience in high school definitely shaped my future major choice. So.
I have to agree with Maddie. I mean, I did like tennis, dance, like I didn't really do specific stuff to like going into like the health field. But like junior year, like summer going into my senior year, I went to a National Student Leadership Conference at Harvard University for like high school students who were interested in the medical field. And in those 10 days, I kind of learned about different areas in the health field, and I never really learned about public health till I got there. So that kind of like opened my eye on what public health and like population health was. And then from there I did like research, and then senior year I realized I really wanted to go in the health field, so I took more biology type classes. I saw a question about like IB, like I took HL biology, and that also like kind of helped me become more interested in the medical field. And then I also volunteered at my town's hospital my senior year. So it's just like little things, but again, you don't need to have something specific to get you into college for medical school. Like Maddie said, like all sorts of activities that make you a well-rounded person are good.
Thank you so much. Anyone else? Any other student want to speak to that? Or yeah, pretty much covered it.
Yeah, just the other thing that I guess I would add is community service. So my school offered a lot of community service, and we were involved with, setting up blood donation camps and, setting up food drives for people and reaching out and volunteering at local hospitals. And that was something that was really valuable to me just to do throughout the year. And then again, following up on the IB question as well, I didn't take IB, but I did take the British system in high school. And it depends for biomedical engineering specifically, what is it that you want to do? So I think biology is the standard, but I was more interested in pharmaceuticals, the industry. So then I did biology and chemistry. So if that's the route that you want to go, and if you only can take 2 sciences, maybe bio and chem would be a good choice.
Yeah, that really answers the question of what are the subjects required in grade 11 and 12 for biomedical engineering. In IB, they do not recommend taking all 3 sciences. So thank you so much for that answer. I don't know, Dr. Jacoda, if you wanted to add anything to that.
Except I disagree with the idea that you should have only 2 science subjects. You really need physics, chemistry, math, biology for a bioengineering degree. And they're not equally important. Obviously, biology is more important than the others. But a distinctive feature of this kind of training is the ability to to do the math, coding, and know the biology, chemistry.
Great. Thank you so much. That's really helpful. So here's a question for Dr. Daly. I was wondering whether we can take the MCAT exam for medical school after completing a 4-year degree course in another subject like microbiology and from another country, New Zealand, Australia, UK, EU, India.
Sure. So first I'll say that you can take your coursework in any country to take the MCAT, as long as you take it, and you can take the MCAT with any major. The most important thing is to take particular classes. And so certain classes will automatically be in certain majors, but you don't have to take them there. So you're going to have to take 2 years of biology with a lab, 2 years of general chemistry with a lab, 2 years of organic chemistry with a lab. Oh, sorry, I'm saying years and I'm meaning semester. So 2 semesters of biochem, physics, organic chem. You're going to have to take microbiology is a recommended, it's not a required. Biochemistry for some schools is required, for some schools isn't. Calculus for some schools is required, some schools isn't. But you have to take the classes, not the major. So it can be any major, and you can take the MCAT after you're done with those and from any country.
Excellent. So this is another medical school question, Dr. Daly. Do the graduates from Lehigh end up landing in medical school? And if yes, what does the statistic look like on this?
Yes, many do. I can't tell you the percentage of our students who actually apply to medical school, but I can tell you of the ones who apply, last check, it was 46% will get in. And while that may not sound like, oh, it's not 100%, nationally, it's only about half of that. So between 20 and 24% each year of students who apply to medical school will get in. So Lehigh is about double that for our students.
I will add to that from my experience, many years of advising undergraduate students, Lehigh does a very good job of convincing students that there are other interesting fields. So I've had lots of advisees who came in thinking they're going to go to medical school and then fell in love with something else.
Great. Yeah, that's true, I think. And of course, if you're determined to go to medical school, you absolutely can make that happen too, so it's really both. It's a good point. So a question, I'll answer this one because there's a quick answer. Can a student also switch between minors during their course? Absolutely. So minors are kind of a low bar. It's basically 4 courses. In general, sometimes there are different aspects like a field experience that's required, et cetera. But yes, students, particularly at Lehigh, students tend to have minors change their mind. Even if you switch, you still have credit on your transcript for the courses that you've taken, but then you can organize, 4 additional courses into a different minor. So here's a question for Isha. How can journalism and media be integrated into the healthcare profession, whether it may correlate to careers straight after college or to, I guess, entering other programs like graduate programs?
I'm kind of figuring that out too, along the way. But I think especially during COVID, the media became a really big thing. Along with population health, there was a lot of misinformation spread. A lot of people who did not have backgrounds in the health field were saying stuff about the vaccine, that there's a microchip, or it makes you just all these rumors and stuff. So I feel like the media is very important in giving information to the public on correct population health protocols and stuff. So I think as of right now, I just plan on finishing my undergrad and then possibly going to grad school, and then from there see how things go, or if I get an internship with a broadcasting or news outlet or something like that. I guess just my inspirational people are Sanjay Gupta and Joan London right now. Sanjay Gupta is a doctor and medical correspondent on CNN. And then also Dr. Fauci, who right now has been going on all sorts of news channels, giving information about COVID-19. I think it's a really new field right now. I was talking to Professor Gomez about this last year, and I think after COVID, it is going to be really popular incorporating, health in the media. So I guess it's a growing topic, and I'm still learning it as well. So hopefully that answers your question. But yes, media and population health, you can definitely combine them together. I was hesitant about it first, but a lot of the faculty in College of Health have definitely encouraged me and helped me through this process on what classes I should take, what kind of internships I want to do. So yeah.
Dr. Guzmana, would you like to add anything?
Yes, I just wanted to say just a quick word that in addition to jobs directly in health media and health journalism, a lot of the organizations that I mentioned in government and in the private sector hire people to help them get the word out about their work, and our communication and marketing directors who often work directly with the media to make sure that they are aware of the interesting research and work that's been going on. So there are other ways of combining your expertise in health with an expertise in journalism. So a lot of interesting jobs available.
Great, thank you. So I noticed that we're at time, but we're going to keep going for those of you who can stay on. We have 6 more questions that we really would like to get to. And I did want to point out in the chat, there's a 5-question survey. If you would fill that out, it will take you about 2 minutes. Before you leave, that would be great to the participants. So let's keep going with the questions though. So here's a question: is there a list of all the fields offered by your college which can guide undecided students like me who are not sure which field they should choose? And so the answer to that is yes. And so you can see here on the actual slide that's up at the moment, these are the majors, 2 majors and 4 minors that the College of Health offers. But across the university, we also do have another slide that I can show you quickly. And I'm sure, there's a chance on the question form to ask for more information. So this is something we can also share with you, or you can always reach out to Shashir. But I can quickly share a couple of slides with you that show you our undergraduate and graduate programs. Dr. Jacoda, would you mind taking down your screens here so I could share my screen quickly? Okay, great. Thank you so much. Let's see. We'll make this happen smoothly since we've all learned how to do these things, right? So hopefully you can see this. This is a list. You can see there are many majors at Lehigh that could lead to health careers, both BAs and BSs. I'm not going to name all of them, but this should give you a sense of, follow your passion, I think, and then seek opportunities that help you engage with health to refine, where you might go for a career. So there's so many opportunities. And then in terms of our graduate programs that are directly related with health, I'll point out a couple of them. Of course, the degree in public health is one, the degrees in population health. Health systems engineering is a really interesting field, I think, where you're taking really industrial and systems engineering ideas and applying them to health. And of course, there are PhDs in other areas: bioengineering, biochemistry, biological. It should be biomolecular engineering, chemical and biomolecular engineering, etc. So, and then all the way to psychology and counseling psychology. So hopefully that gives you a quick overview. And if you want to dive in more deeply, Shashir can certainly help you all out with that. So there's a related question that I think is really interesting up here. And I'm going to direct this one to, to really any of our panelists, especially the professors. Can you please elaborate more on research careers that require a medical degree versus those that require an advanced degree in science? So I think any of the other 3 professors on the panel could answer this question, probably from different perspectives. And maybe we'll start with Dr. Jacoda, if that would be okay. What are the careers related to advanced degrees in science, Dr. Jacoda?
So I always tell my advisees in bioengineering that if you sort of have 2 broad choices. You can, after a bachelor's, you can choose to stay technically focused, or you can choose to become have planned not to be in the lab hands-on, but go more into management. So the choices really are, if you want to stay as with an engineering degree involved on the technical side, you do need a graduate degree, a master's at least, and sometimes for certain types of jobs you need a PhD as well. But the other option is to work after a bachelor's degree in a technical area, and then go and get a professional degree like an MBA, for example. And that combination works very well as well, opens up all kinds of doors. Does that answer what you're looking for?
Yeah, that's wonderful. Thank you. And Dr. Daly, could you elaborate on the medical side? What do research careers look like when someone has a medical degree?
So if you want to go into medical research that involves clinical care, so there's a lot of research that focuses on caring for patients better, or on the clinical end of drug discovery. So once drugs are manufactured, then you have to test them in people. And that's clinical care is a part of that testing. And so you must have a medical degree if you want to go into that patient care end of things. But there's a lot of clinical research that doesn't involve direct care with patients. So there's a lot of people who are in science. So for example, on the early end of drug discovery, that's all advanced science degrees. There aren't nearly as many people with a medical degree doing that. There are some, but the vast majority are going to have an advanced science degree. Once you move forward in the clinical trials, obviously the interacting with patients is for a medical doctor, but it's scientists who are doing a lot of the behind the scenes work on those as well, just not interacting with the patients in the same way. So, you know, the only time you really have to have that medical degree is if you want to care for patients in some way or do research involving care of patients. But you can certainly do tons of things with that science degree. So I think in a lot of ways, the graduate degrees in the various science fields are a little bit more flexible than medical degrees, even though sometimes medical doctors will try to get into the science. But often they wind up getting additional master's degrees or things like that to be able to do it.
And Dr. Guzmano, would you add anything about advanced degrees in public health, health policy, and global health areas?
Sure. Well, I mean, just to say, much like Dr. Dale was just mentioning, there are people with MDs and other clinical degrees who get involved in public health, in health policy and global health. Someone mentioned Dr. Fauci before. Obviously, he's a medical doctor, but as well as a scientist. And I have frequently worked with physicians in some of my work in public health and health policy. Sometimes it's because they've gotten other degrees, and so they've rounded out their education. And sometimes it's because they're involved in what we call team science. And so it's important, if you're studying health policy and you're looking at what kind of policies we should have about what types of medical care services to finance, that you actually know something about clinical care and what works and what doesn't work in clinical care. But that doesn't mean you have the expertise in political science, economics, and the other fields that can contribute. And so you can have a fairly wide variety of degrees in public policy, in public administration, and in public health to conduct research in the broad fields I talked about, but we're often collaborating with clinicians as well.
Great, thank you. Thank you so much to all of you.
Can I just add one thing which I forgot?
Sure, absolutely.
So I do want to mention the MD PhD route, which
Yes.
is, well, it does add yet another 3 to 4 years to the training. And it's for the really ambitious people, I would say. But there are some who like to do it, and I work with students who are stellar if they go that route.
And I think in general that, yeah, those PhDs are in scientific fields, but I'll tell you, I have a colleague who has an MD and a PhD in English who invented the field of narrative medicine. She's at Columbia University. So, you know, follow your passion, you know, you may invent something new if you do that, which is quite exciting. So here's a question it's just absolutely designed for you, Dr. Jacoda. So this is from a student named Jakan. He's a biomedical engineer, and he's interested in pursuing a PhD in biomaterials and tissue engineering. He requests that we talk a little bit about what that would look like.
So that's one of the 3 legs of the bioengineering program at Lehigh, as it so happens. We have a lot of interest in biomaterials, tissue engineering. This is the one of ways in which modern biomedical engineering is actually different from the traditional one. So if you recall the picture I showed, there's a bunch of traditional applications of engineering, important though they're sort of mundane in the sense that they're traditional ways of applying, let's say, design of prosthetics. You design a part for a car, you design something for a prosthetic. The constraints are different, but there isn't intellectually that much that's different. Tissue engineering and biomaterials is the interface, literally, between modern biology, which is based on molecules, cells, and modern engineering. And it has a language of its own. It's emerged as an important part of bioengineering research anywhere. And it's given birth essentially to the new version of our discipline.
Great. Yeah, that's really helpful. And you can certainly go online if you're interested in the kinds of research being done at any university that you're interested in. You'll want to go to the web pages. I know that on our webpage for bioengineering, there are news stories about faculty doing research in tissue engineering, for example, and other materials sciences. So you'll want to do a little bit of research. So here's one that really, I don't know if the student is still here, but I think we can all empathize with this one. Due to COVID, I personally have missed out on small experiences like the ones that students here have mentioned. Is there anything else that helped you decide your major? So alums and students, could you answer that one?
Yeah, I would say that, so when COVID happened, I was a senior in high school, and I felt like I still kind of missed out on some opportunities to kind of decide my major because I finished up my high school career on Zoom, which I think we can all agree is not as great as in person. So, and we're all really hoping that this will be a temporary fix, but I definitely say that there's still a lot of research out there. And one thing that really helped me is I actually connected with a lot of Lehigh professors when I decided to attend Lehigh. So I would say even if you choose to not go to Lehigh or you find a different school that's a better fit, I'd say one way to really find out what kind of major you want is just to connect with students and connect with teachers. I think also a really good thing is you have your guidance counselors at your high school. I know that we met with them a week or so ago. So I'd really encourage just to continue to reach out with them and talk to them because they're there for a reason. They're going to provide you with really great experiences. So I know that sometimes online work and emails and communication is not always the best for compared to in person, but it is something that can be really helpful. So I actually decided to go to Lehigh early into the summer, which is a lot later than other kids. So I was kind of feeling like I was almost a step behind, but something that really helped me in feeling connected and having these ideas and connections of what I wanted to do was just really reaching out. So I just really emphasize that. So.
The other thing that I'd like to add is you still have pretty much your freshman year or your first year to decide what it is that you really want. You've heard about people being in College of Arts and Sciences and switching to College of Health. I switched into College of Engineering spring semester of my freshman year. So, being at Lehigh and being, I think, just a US-based university as well, you can take whatever courses you want that first semester or so, figure it out what it is that you really want. So I wouldn't be too worried about that.
Yeah, I was gonna add that it's really just about like the classes you take. Like I mentioned earlier, I had no idea what I wanted to do when I was going to college, and it was making me super nervous because I felt like all of my friends and like other people I knew and other students that were also coming to Lehigh were like, oh, I'm gonna major in this and I'm gonna do this in the future. And I was getting so stressed because I was like, should I know like exactly what I want to do? But I took a wide variety of classes my freshman year, and it wasn't even until I took my first few population health classes last year that I decided my major. And now even like all the friends that came in thinking they were going to major in biology or like, no way, like I switched to psych. Like people switch their majors all the time. And I think once you start getting into the coursework and like really seeing what a certain field is about, you can kind of start talking to more people and like Maddie was saying, like network a little bit, talk to some professors, see what they do, and just really learn like what the opportunities are in each field and like from what classes you're taking and figure it out from there.
Yeah, I agree as well. I think it was very hard. Like I was in the same boat as Maddie. I graduated when in 2020 of high school when COVID was still very unknown. And so especially like picking a college, I was between Lehigh and another school. And it was very hard for me to decide because both schools had different attributes that I really liked. But I talked to 2 professors in the College of Health before committing to Lehigh. And I think they really helped me and answered a lot of my questions because I was still uncertain what truly population health is and how can you teach classes about it. It just seemed very confusing to me, but they really helped me answer all my questions. So if you are interested in Lehigh or in the College of Health, or even if you're uncertain, I really recommend you email one of the professors on here or any of the professors in the College of Health. All of them are super willing to give you all the information they have. Like they will literally bombard you with as much information as in a good way. And then I also think that like it's very common as a senior to think you have to have your all 4 years of your college like figured out and finalized. And I used to be like that. Like in the summer, one of the Sherry Boost, the advisors of classes here, I was bombarding her with, oh, like I need to take this many credits for this. Like I need this class, I need this class. Do I need this class? And she basically just told me, take classes what you're interested in. And I really took that to heart this year, taking like my entrepreneurship and communications classes, that I realized like this is truly what I'm interested in. And whether it's not like a population health class or a medical class, I do recommend taking more fun classes, whether it's a language or a hobby or something, because that also makes you more of a well-rounded person. You don't have to always take all the science courses. I mean, definitely take them, but also take stuff that you're interested in. And it's fine to not know what you're doing your first year of college.
Yeah, and this is just oh, sorry, I was just going to say, just a small little plug for Lehigh in general. Something that I have really enjoyed now being in my sophomore year is I feel like my professors really know me. They, like one of my professors know where I'm from, you know, they know what I'm really interested in. And so I feel like that's something that I really enjoy about Lehigh is you don't feel like you're just being taught by someone, but you feel like someone's trying to actually learn about you and how they can best teach you, which I think sometimes at an undergraduate university, you don't always get that experience. So just along with meeting with your professors and emailing them, I think they really do care. So that is something that I've really noticed at Lehigh and have really enjoyed, because I feel like the professors do actually know me as a person and not just a student. So.
Thank you guys so much. I always think it's so valuable when we have students and alums here to give it, you know, on the ground advice. You know, they're experiencing it, they're in the middle of it. So thank you guys so much for being here to provide those answers. So a couple more questions. One student has written in who's interested in marine biology. And this student is currently completing the International General Certificate of Secondary Education. And so for those of you who don't know, it's a 2-year program leading to externally set, marked, and certified examinations from the University of Cambridge. And so it's a qualification that's recognized globally. So I think the question that might be implied here is, what's the advice for someone who wants to pursue marine biology? We don't have marine biologists on the call, but I wonder if anyone can offer some thoughts. Perhaps Shashir, maybe. I know we have a major population health who's doing a concentration in oceanography. So I don't know, Dr. Daly, if you've gotten any insights from talking to that student, but anybody feel free to jump in to help this student.
I think it's a wonderful thing to think about marine biology as a career, but I think you are just trying to reduce your chances to a great extent, because at bachelor's level you should try new things. You should try keep few more options open. If you're going at the marine biology in the bachelor's level itself, think of it as mixing it up, preparing it up as another major, or we all at Lehigh have few options. We have environmental engineering, we have environmental sciences. Go with them in the beginning. That will open up so many other options to you. And in terms of marine biology, yeah, it's a great major, I must say. I think you can just check all the other majors, but I don't think that we have marine biology as a major at Lehigh. But as I said, don't try to. That's my suggestion. You can do whatever you want. It's your career, it's your choices. But try to have a bigger option at the bachelor's level and try to specialize as you go more towards the master's and PhD programs. So that's what my take is on how to pick and choose your bachelor's majors and minors.
Yeah, just to follow up on that a bit, I think that was a follow-up from an earlier question about entrance examination and admissions processes.
Oh, right. Okay. Yep.
I would recommend, there are some schools that do have that undergrad degree in marine biology. There's less of them, and Shashir is absolutely correct. You know, using the undergraduate study to kind of figure things out is a great idea. So you may want to look at just general biology programs and think about that. So you're looking at very standard requirements for college undergraduate programs, which is going to be like the SAT, ACT, and to just have, you know, a high school diploma, but in your case, you would be applying a little bit further along. So I believe that degree comes in and you'd be taking, is it 2 more years of college after that one? Is anyone familiar with that?
Shashir is.
So, you know, it's a subject area. You know, many universities offer it across the world. It's not like that no one offers it, but, you know, most of the people, unless until they are totally sure, because think about the career opportunities that will stem from it. You know, there will be very limited career opportunities that will stem from it. And that's why my recommendation was at bachelor's level, don't be as specific in your, you know, subject choice or career choice. Try to have some more options, because, you know, we think it will be an amazing option, but unless and until someone or you experience that, it turns out to be, hey, it's a very specific. Because, you know, when I did my master's in biotechnology, I was thinking that I will be the one who will be coming up with, you know, robotics, and then there'll be humanoid that will be walking on Earth by now. But that didn't happen. You know, it took so much time for us to come up with something in research. So, you know, sometimes it looks amazing when you think from afar, but when you actually dive deeper into it, then you realize that how many career opportunities that exist. But if you're really passionate about it, then think about the universities that are offering that particular major and specializing it in that area. And think of, and also meet someone who's actually working in this sector and which role you want to work in future. So unless until you know someone who is doing brilliantly and that's what you want to do in future, don't specialize in that specific stream. That's what my suggestion will be.
Great.
I would also make a plug for ONET, so the database I mentioned before. So if you want to get a sense of what the career opportunities are in marine biology and what sorts of degrees that you should pursue, you can type that in, and I believe there will be links that will be helpful to you.
Great. So we have one more question, and this one is again for the professors, I think. So currently, are there any internship opportunities over at Lehigh University for international high schoolers? So one thing I'll start off by saying is that unfortunately, we're not able to pay international students who aren't actually in country. So let's like reframe the question and say, are there any unpaid internship opportunities for international high schoolers at Lehigh University? What do y'all think about that? I know it's not very common. Well, I actually have one idea I can add to before I let you guys talk. Sorry. We have a program at Lehigh called STEMC. So it's STEM Summer Institute is basically what it is. And it's for students who are interested in STEM fields who are going into college, or maybe you have completed 1 year, but it's for high school students too. And it's actually a funded program, and students can come here, or some of them are remote projects working in research with faculty at Lehigh. So that's something to keep an eye out for, and Shashir would have information on that. But let me turn over to the faculty to answer this final question.
So I don't know that much about formal programs for high school students. I have in the past worked with some undergraduates and high school students in other countries on some of my research projects, in part, sometimes because they were working with collaborators that I had in their home country, and sometimes because they simply sent an email to me and they were interested in doing a summer project, and we were able to offer them an opportunity to look at some questions with our supervision. So I've been studying big cities around the world for more than 20 years. One of the cities I've looked at is New Delhi. And so we have compared New Delhi to Moscow and Sao Paulo, and Beijing and Shanghai. And so we had some data on New Delhi, and we worked with collaborators in India. So if anyone's interested in looking at health in big cities, feel free to send me an email. And sometimes you can make arrangements like that with faculty, particularly if you look at the website, you see their ongoing research. If it's something you'd like to learn more about, they may be willing to give you an opportunity for this sort of more informal, perhaps over the course of a year or even during a summer small project.
Thank you. And I'm gonna, Dr. Jacoda has to step out to actually teach a class. Did you want to say any final words, Dr. Jacoda, on this question or anything else?
I'll just say that I've had a lot of high school students work with me one-on-one. Some of them have actually been co-authors at the high school, but I've not done that with international students. And so I'm not really sure if there are barriers to it. The one you mentioned, of course, not being able to pay is one. In general, the faculty here work with undergraduate students on research all the time. So nearly every research lab has undergraduate students. High school students, it's a little trickier. To take on high school students, there's more paperwork and things like that involved. But I've done it, others have done it as well.
Great.
I'm sorry I have to step out for a 10 o'clock, but it was nice meeting everybody, and I hope this was useful.
Great.
For the audience.
Well, I think, sorry, did anyone else want to add anything? If not, we can say goodbye.
I have one point to add here. We at Lehigh have IACOCA Summer Intensive. So it's 1 month program. So you can come to Lehigh campus for 1 month. Fingers crossed. I hope you will be able to do that next year. And we also have 1 week intensive. So health intensive is also there for 1 week. I think that might come in next year. So keep looking up, keep me posted if you're interested in the same, and I will keep you informed if something like that is planned. And so definitely we can do many things. And as I said, this is just the starting of the engagements with our international group of students. We will keep on introducing new workshops, new opportunities for you to be engaged with the University and College of Health. And again, would like to thank everyone and pass on again and request Dr. Dolan to thank on behalf of all of us to you.
Yeah, I just want to thank everybody for attending, and thank you, Shashir, for organizing this and giving us this opportunity to reach out to students and hear their questions. I just want to remind you one more time, participants, please fill out the 5-question form. That helps us get you your certificate of completion, and making sure it helps us make sure that your name is correct on it, and also gives us feedback. What might we do next that you would be interested in? So thank you so much, everybody, and thanks so much to the panelists. I really appreciate everyone's time.